As I said earlier, I'm honored to be here with you all, and I know this is a multidisciplinary group, and so hopefully my presentation today will appeal to everybody. There'll be a piece in this presentation, hopefully for every one of you. So we're going to talk a little bit about evidence-based treatments for adolescent substance use. And we're going to talk a little bit about some off-label investigational use for medications. As you'll learn, there's actually no FDA-approved medications for adolescents with substance use disorders. So any medication that we talk about in that regard is off-label. I always start my talks on adolescent substance use with this slide. I like to remind my colleagues who work mainly with adults that the majority of addiction actually starts in adolescence. So these are the three most common substances of abuse for adults and adolescents, so tobacco, marijuana, and alcohol. And you can see the addiction rates, or the developing of addiction, really starts in the teens and early 20s. An interesting sort of trend here with tobacco, you can see that it spikes even in the older years, so it bucks the trend just a bit, but still it's largely a phenomenon of adolescence and early adulthood. So I love this slide. I wish I could claim credit for this. So why are adolescents uniquely susceptible to substance use disorders? Well, we know in animal models that the little rat that is doesn't have good judgment, is always looking at the outside, novelty seeking, going to the outside of the cave or the cage, and looking for everything that's always new. Those are the rats that are more likely to get addicted. And we see that in humans as well. So those of us who are more impulse seeking, who struggle a little bit with our judgment, we're certainly more likely to get addicted. And this is a phenomenon of our brain development, right? It's not our fault. This is the way our brains grow. You know, our brain growth starts from the back to the front, which means the front, which is really the area that's supposed to be the brakes, right? The front of our brain is supposed to say, whoa, whoa, whoa. I don't know if that's a good idea. That's the last part to grow. So sometimes into our mid-20s. So I think we're saying about 25 right now is when we think most of the growth is finished. So what's another unique phenomenon of adolescent substance use? Well, I gave a talk recently about influences of media on adolescent substance use, and it's a huge topic. This is just one slide from that talk. So these are the trends in substance use disorder over the last 20 years. So the University of Michigan, as many of you may know, they poll adolescents in the high school, and they say, hey, what are you using?